Next, we have Matt coming up. So Matt, if you want to give a brief introduction to what you're all about.
Well, my name is Matt Arnott. I am a physiotherapist in Brantford, Ontario, and that's up in Canada. I don't know if most of your viewers are US bound or where they're from, but physio is physio wherever you do it. I have been practicing for 20 years, actually, physiotherapy. The last 3 or 4, I've also been involved with a prep school up here in Brantford, and they have a hockey and basketball program going there. So that's been my experience working with the professional athlete side, as well as people coming to see me privately in my clinic.
Got it. Awesome. And so as a player and somebody coming into kind of a professional setting, what should someone expect when they go to a healthcare practitioner?
Yeah, that's a good question. And there should be a very general approach, should be the same for most disciplines, I would think, when you go in there. The first thing you should get is a thorough introduction from the person on who they are, what their qualifications are, and what they intend to do with you in that session or over the long term. You should expect a lot of questions. There should be a question asked of you. What are you here for? What is it that you're hoping to get? So there's some expectation there. And you should have that in advance when you come in. You should plan to tell them what you want. It's not just go and sit down and they're going to go on autopilot. Once you've had those, there'll be a lot of background questions on, what got you there, talking about how things started, your symptoms, and going through that. There may be things we will ask specifically about what makes it better, what makes it worse. Check your past medical history, any other medical conditions you may have, just to get a thorough understanding of the person in front of you and what's brought them here and all the mileage they have behind them. We'll ask if there's any other healthcare practitioners involved with it. Now, this is if you're coming to see me privately. If you came to see me as part of the sports team, well, I would already have access to strength conditioning, the coach, maybe the sports psychologist. If you're lucky enough to have a dietitian too, that's also important. But then, after that, there should be some kind of physical analysis, whether it's of the injured area or a movement analysis to try to determine, where, if there's a faulty movement pattern. That's, when you think about physiotherapy, it's the nuts and bolts of how you're moving, but so many other things we have to put on top of it. But essentially, you're coming in and you're trying to identify what an impairment is, which is, lack of range of motion, lack of strength, too much, too little, that sort of thing. And then when they finish doing that examination, there should be some kind of summary made. And that's really the part that sometimes gets skipped, but that's the most important. As you sitting there across from them, you want to have an idea of what they think's wrong with you, if they think that they're going to be able to help you, how they're going to be able to do that. And, going forward, there should be you should walk out of there with an idea of, how long is this going to take? What kind of things do I have to do? Do I have to see anybody else? Potentially, what's this going to cost me if I'm looking at, am I looking at coming for 6 months, or can you get rid of this in a few weeks? And we'll also structure that based on, knowing what the person's background is. Are they very independent? Do they have access to their own gym, or do they need to be supervised when they're doing that? So by the time you're finished, you should have that kind of laid out, and you should walk out of there. Well, certainly the last thing, I guess, is you should have an opportunity to ask questions. And that kind of goes out throughout the whole time of it, but certainly people need to be able to feel that all their needs were addressed. You shouldn't walk out of there feeling like you got rushed. And it's a common concern. People will go in and see, they wait 6 months to see an orthopedic surgeon, and when they get in there, they're in and out in 5 minutes, and they're not quite sure what happened. So I tell all of them, if they're going, have your questions written down and don't let them leave until they've been addressed or you've had a chance to ask them.
Right. That last point is, I think, the most important thing I learned, I think, from you was having that list prepared in advance, because it's very easy to show up and then kind of get overwhelmed because as just an athlete, you often don't really know a lot about all the different muscles, tendons, joints. But if you can come in, have like a notepad or have your notes on your phone ready and have those things set, it definitely allows you to come in and be so much more comfortable and leave knowing, okay, I actually know where I'm headed, not just do these exercises for the next week.
Right. And you know what, that's a good point, Corson. You don't have to have a background in anatomy to know all this stuff to talk to somebody. I always felt, and from the very beginning, people, you own your body, you know what's wrong with it. You may not be able to articulate it or say it in the way that somebody else, in the language that somebody else might be using, but it's got to make sense. If somebody tells you something in the end, you think, that doesn't make sense. It's probably not the deal, because you own the body. So things will make sense, and you won't be far off. Most of what I can, if I take a proper history from someone and ask them the right questions, I've got a pretty good idea before I even lay my hands on them what's going on. And so a lot of that comes down to the questioning, but just trust that you know a little more than you think when you go in there.
Right. And when going into a health, like going to a professional and knowing that there's something wrong, how do you start to kind of build that trust with that person and really start to feel comfortable? Because I know it sometimes can be a little tough. It can be a little challenging to know, hey, like this person's now gonna kind of help me figure out what's wrong with me, and if they mess it up, I might be dealing with this injury forever.
Yeah, well, yeah, that is a really, really important thing. So I guess when you're going in to see somebody, sorry, I have a few things written down here. Yeah, I would always say you can always do your background information on them first. Nowadays, you can just go on the net, you can look up anybody, you can get reviews on them. Most people should have a bio on there. So get a feel for whether this person has what they're looking for. Now, with the guys you're talking about and the women that are playing hockey, if they're involved with a team and if it's a program like that, you should have access to them regularly. And you don't necessarily have to wait till you're wrecked to go in the first time. I would try to go out and talk to them. Go meet that person if they're on staff or faculty, and see them when you're not injured. And just, if you're curious, some people aren't, that outgoing that they want to go do that, but there should be an opportunity where you get to meet that person. So that's the beginning of it, just to have them know your name, recognize you saying hi to you. That's a good start. Like I said, and then, check with other people. Maybe you've had teammates that have seen somebody and you can get their idea whether they like that person or what they thought of them. That can give you another good idea. But a lot of the onus is on the healthcare professional themselves, I think. And they should be doing a good explanation of, who they are, what they're there for. I mean, they're there to look out for you first and foremost. And we'll talk about that again at some point, I'm sure. But that's the number one priority, is that, you're well taken care of and they've got your best interest in mind. I think also as a healthcare practitioner, you have to be honest with the player. You're not really going to do them any service by saying, yeah, I think we can have you ready for next week, when they've, just completely blown out their ACL. And the reality is, you sometimes have to have that hard talk with them. Now, generally speaking, the surgeon kind of delivers that kind of heavy news, but you can certainly prepare them and say, you're looking at, potentially a 12-month rehab on this. And I think in the end, when you come in and you certainly don't underestimate things. We're all optimistic. We want things to get better faster, but there's some things that's beyond your control. So you need to make sure that you're straight up with them. I think that goes a long way with developing trust. And then I think probably the last point would be that you should try to incorporate the athlete in this process of rehab. Ask their opinion on things. Goes a long way with anybody. If it's a collaborative approach instead of somebody just forcing things down your throat, speak with them and get their opinions. There's always a couple of ways to do things, and someone that doesn't work for them. So I'm not very didactic that way. I generally tend to say, well, what do you think about this, and get their opinion.
Got it. And I know you were talking about pain, and that was an area that I really wanted to cover, which is, how can players start to understand when you are feeling pain, when to start to take that seriously? The difference between maybe just fatigue and feeling like a sore muscle, as opposed to an actual potential injury that could cause, or that could lead to something bigger in the future.
Yeah, I mean, it's pretty self-explanatory when you get hit on the ice and your, shoulder's not in the socket anymore, that's the kind of injury that you need to get addressed right away. But most of the other things tend to be things that kind of slowly wear on you, and they take, you can put up with it for a while, and then at some point it becomes noticeable. It's, when I'm seeing people in my clinic, it's not very often that they come in and say, oh, this started hurting me last week. Most people, when you ask them how long, they'll say, well, it's been a little while. And then I generally start out by saying, are we talking weeks or months or potentially years? And when you give them that opportunity, then they kind of, there's usually a little smile and they say, yeah, it's probably been more like 4 months. That's how long it's been going. So then you get an idea of, how long they put up with things and what they've been going through with it. So, I mean, we talk about the obvious things like immediate swelling, trouble weight bearing on a joint. Those are things that you're going to go off the game right away. But the other things are, I guess, if you start noticing that you are favoring or changing how you're doing something, other people may notice it before you do. Because when you're kind of living with it, you kind of just roll with it and you keep going. But, the strength and conditioning coach may notice, you're not pressing very well through that right side when you're doing, or if they're doing unilateral work, it might become really obvious one side is, much weaker than the other. And so you might start to hear it from other people, or they might, that maybe where the athlete first notices it. So, I mean, there's only so much you can do in clinic and in a therapy room you can't really get. Sometimes people will bring in some footage for me on ice and so forth. I mean, if you've got access to games or if you're there watching, that's the other thing you can do. But those are the first signs, is that the biomechanics start to change. You start to do things differently, and that's really a problem, because then you start compensating. And by the time you get someone to look at it, you've got about 3 things you've got to undo to get back to the original problem, because you develop too many compensations.
Right. Yeah. I think that's one of the biggest things that I've messed up with my kind of injuries in the past is I've always used to think like I can just tough my way through it, kind of like me and Sharon talked about with the mental side. And
Yep.
I think that's such an important point. So like with that, do you suggest that players like start to look into you mentioned like sending video in, but do you think it's something that's worth kind of considering, is like, hey, I send video in, I ask my therapist to actually look at this stuff, because I know I probably have had different muscles and different things that weren't moving properly that maybe I didn't think was an issue. But do you think that's something players should prioritize and consider early on, or maybe not?
I mean, sometimes like your therapist isn't necessarily, if they're very specific to your sport, that could be very helpful, that they could just watch some of your footage and pick things out. But other times it's maybe more specific to the area when you're having dysfunction or when you're having your pain. So, maybe when you're doing a slap shot on the follow through, and then you can take it in and say it's right here when it happens. And that gives them a better idea. Say, well, what is it? Is it lower extremity that you're not transferring the load properly? Is it at a certain wind up with your shoulder and external rotation that you're hitting that? So that's really important. And people can try to explain it, but a little 10-second footage can say a whole lot more than a conversation can take. And certainly being able to slow it down, freeze frame it, rewind it is important. So you wouldn't just send that out to a therapist before you even get there. It's something once you've established a relationship, but if you have some of that to bring with you, I think that can go a long way.
Awesome. Well, yeah, I definitely learned something there. I've never even considered doing that, but that's something I'll definitely look into in the future with a therapist that I work with. Awesome. Okay. And then the last question I wanted to ask was, in terms of kind of getting the mental and physical aspects of dealing with an injury figured out, is there some advice you have for players when they're dealing with this stuff, like what they can expect mentally, what they can start to do in terms of like strategies, tools to use?
Sorry, are you talking about, if they're injured, how do they get the mental lined up with it? Or are you speaking more like that?
Yes. Yeah.
Yeah. Okay. So once there's a physical injury, that's it is a big deal. You think, well, you've hit your timelines. It's been 12 weeks. Everything's healed up. You pass the strength test. You should be able to get back out there and play. But that's not necessarily where it starts and stops at that point. There is a huge mental component to, that fear that is there something going to happen when I get back out on the ice again? When I get in that same situation in the corner where I've got to, receive that check, my shoulder going to hold up again when I get hit? So that's probably more something that Sharon could help with, I'm sure, in terms of coming up with the strategies that you might use. But there's lots of times where you need to, and it gets a little beyond what I do, but I do bring this up to people because I don't know that they think about it all the time, but the mental rehearsal. I mean, you can have the range of motion back and you can have all the strength there, and we know the weight bearing's ready to go, but you've got to kind of see yourself in that situation before you get back out there. So ideally we will ramp things up and say to them, okay, well, now you're ready to go back out, and maybe early on you can get back out there and skate with the team, okay, just so that you're back on the ice, you can get that feel and be around everybody again in that atmosphere. And then maybe you're in a non-contact, doing drills and so forth. But eventually we want you in there, doing the scrimmage and receiving the hit. And ideally the first time that happens, it isn't back in a game. But at the same time, no one's going to take a run at you in practice, because that's kind of defeats the purpose of just practicing. But so if you can't simulate that, then mentally you've got to sit yourself down and go through that, and you can see the lead up into it, and there'll be lots of things that happen with that. Anxiety will happen, and you're going to have to recognize when you're starting to feel like that, and have maybe some mantras or things that you say to yourself to kind of settle yourself down, some breathing techniques. I'm sure there's a whole slew of things out there that you can do, but realistically, from the role of what the therapist role is to prepare you so that you think, okay, I have a solid foundation. I know we can talk about the physiology with them and say it takes 48 hours for this and 3 weeks for the consolidation, and the remodeling phase takes. And so once you hit those stages, structurally that bone is ready to take that pounding again. And so try to give them that reassurance. And as long as they've got their strength and their range of motion flexibility back up, then I mean, it should be there. But realistically, you shouldn't go back out on the ice with a whole lot of questions. If everyone's done their job properly, there should have been a gradual lead up to that. And then if the last piece from our point of view is if there's anything protective we can do to help make that a little more sustainable, whether that's bracing, whether that's a different set of shoulder pads, maybe it's something as simple as kinesio tape or something that you put on just to give a little bit more proprioception and just mental reassurance. I could feel that. I know where my shoulder is right now, and those are the things I think that we can do.
Awesome. Well, thanks a lot. I think that really covered a lot of ground, and I think we were able to capture a lot. Is there any other advice or points that you wanted to highlight that maybe we didn't cover there?
No, I think a lot of that, I wanted just to reemphasize what Austin had said, and actually Sharon said the same thing, and you're going to hear this from everybody. This is all about communication. When you're dealing with an athlete, there is a whole team of people behind them, and the more those people talk, the easier it is, the better it is for that player. So communicating with coaches, and I'm constantly in upstairs to talk to the coach, run in to talk to the strength and training conditioning coach in there as well, so that everybody, and with the AT, so that everybody's on the same page. So you have expectations from the individual, but then you're constantly updating and individualizing that program for that individual player. So yeah, I just think that you're in a good situation when, and I think you should insist this, if you aren't part of a program with a team, with a physiotherapist, and you're seeing somebody independently, you should insist that, hey, here's the name of my strength and conditioning coach, my contacts for these people. I'd like you to, let them know that, because sometimes you passing an information on, it's secondhand, it doesn't work so well. So obviously the therapist needs to get consent from the client, but once they're okay with them communicating, then I think you should let everybody talk as much as you can. It's in your best interest.
Awesome. That is really, really good advice. And I think that's a really cool strategy to take to almost kind of build your own performance team if you don't have one.
You should, yeah, everybody should have it. If you know, if you're, I would say even if you're 15 and older and you're still really serious about your sport, you should have a team of people going behind you that you've assembled. I know you did your version of that when you were coming up too. That's important.
Awesome. Well, thank you, Matt. I really appreciate it. And we'll keep things rolling here.
Yep.
Sweet.